name is Vishal. Vishal Ibrahim. You might know me as Iskak Ibrahim's son. I'm a medical doctor, general practitioner. And it's an honor for me to be standing here. I'm looking at the room filled with the pillars of our community. See the uncles here who fix a car by simply grabbing a piece of wire and a bit of dua. I see the brothers were the first to arrive at janazas and the last to leave the Aqifas. We all kept Cape we resilient, we've survived things like lockdown, we've survived things like load shedding.
Die mic in die mond sit.
All the way up. All the way
Excuse the
up.
pun.
Is that better? All right. Like I was saying, we are Camptonians. We survived a lot of things. We've survived lockdowns. We've survived constant load shedding. We've survived the price of petrol. But there's one thing we struggle to survive, and that's admitting that we need a doctor. We need healthcare. Now, as Muslim men, we age, not myself, yet we tend to enroll in a type of institution. It's an institution that we all know very, very well. It's an institution where at 2 a.m. your cousin Fatima, your friend, come and sends you a message on WhatsApp. It's the institution, the University of WhatsApp. Now, while these forwarded messages and videos come from a place of love, they can often be a recipe for disaster. Now, I see this a lot, the practices of it, and main thing about it, like the instructions of the new price tag. They throw the instructions away, simply trying to force pieces together, and only when they figure out that this is permanently broken do they reach out for help. Statistically, when we actually look at it, we are the masters of symptom masking. We blame it on something else. Now it's the weather. Now it's what I ate last night. Now it's my wife's cooking. We'll take the Baki into that 15,000 kilometer service. At the moment, we first see that little flicker on the dashboard. But our own internal check light will wait 5 years before we have it seen through. Today, we're going to set aside certain stories, all the remedies, the lemon water in the morning, and we're going to discuss some real facts. And some of them might be slightly uncomfortable, but this is a safe space, and whatever says yes, stays here. And the things we're going to talk about are things that suddenly creep up. And it's 4 very important things, and that is hypertension, diabetes, prostate disease, and yes, erectile dysfunction. Now, I want to start talking about the first silent visitors in our community. And these are the travelers that travel quiet in our community, much like someone like going to Sunnah Solars at the mosque, serving out quickly. We're talking about hypertension, high blood pressure, and diabetes, high blood sugar. Or, as we know it in Cape Town, we're gluten seeker. Now, something I hear almost every day in practice I work at is, Doctor, I feel fine. My blood pressure only goes up credit card statement, or when Eskom switches the lights off. That I do. But the reality is that hypertension, diabetes are nicknamed the silent killers, and this is because they seldom a warning. It's quietly damaging in the background before you even feel it. Sometimes, unfortunately, the first symptom is a stroke. So, to sort of summarize and understand what high blood pressure is, right? So our heart is a pump like it, right? Our blood vessels are like little pipes coming from this pump. Now, in a regular healthy heart, regular healthy blood vessels, there's smooth flow to all the areas of the body, vital areas of the body. With high blood pressure, it's like standing on that pipe, creating kinks. Or it's like having pipes where the internal side is rusted and narrowed. Now, obviously now that the actual pipes are narrowed, the heart has to work, the pump has to work hard in order to give blood to the areas that we actually need. Now, obviously with time, that eventually leads to the heart not being able to actually perform those functions. You know, the heart can only take so much pressure to actually push beyond that. And unfortunately, that's when actually things like minor tears develop. And in those tears, actually, little cholesterol plugs in areas. Right? It grows and it grows and it grows. And eventually, when these blood vessels cannot handle the pressure enough, they physically tear open, like any pipe, any hose pipe, anything. And in that moment, we get strokes. And not any particular type of stroke, we call it hemorrhagic stroke, a bleeding stroke. The blood vessel is literally broken. Now, again, the scary part here is that those were the first symptoms. I mean, I've seen cases in 45-year-old men where the first symptom of high blood pressure was unfortunately the stroke. Now, enough seriousness aside, almost every day I hear some sort of a myth surrounding either high blood pressure, diabetes. I just like to address some of those myths. Some of these might sound very, very familiar. So, the first one, and probably one of the most dangerous, is patient comes in, he'll tell me, doctor, I only take my tablets on the days when I have headaches. Now, high blood pressure is chronic. It is for life, right? And when you actually take these pills, right, you are actually acting as a shield. What's important to understand, right, is that high blood pressure, headaches, those little headaches that we experience when our blood pressure is high, right, can happen from minor jumps from a normal blood pressure up to something like 160. Right? It's that rapid movement of the blood pressure that causes it. Now, if you're walking around with numbers like 200 over 100, those are stroke numbers, there won't be a headache because it's constantly 200 over 100. There's no jump. So then the first symptom in that situation will often be the stroke. The second myth, and I'm sure it comes from a good place, but some faulty logic. So, patients often come in and tell me, doctor, I had my blood pressure checked at the pharmacy. It's normal, so I stopped taking my blood pressure medications. Now, that's like saying, when you wear your glasses, you can see. So you can see, so now you can take it off. Not quite the same thing, right? Blood pressure medication works because you take it. The number you see, the nice, good, healthy number, is because of the medication, not in spite of it. So, another thing that's become very, very popular, and maybe your wives might mention it as well, and that is patients often come in and say, doctor, I don't use this white salt anymore. I'm using the pink Himalayan salt. It's natural, so it's healthy. But the fact of the matter is that salt is salt. Your body doesn't know the difference between fancy pink Himalayan salt that comes from Pakistan versus the regular white table salt you get at Pick n Pay. The sodium levels or the sodium levels. Those are the major drivers of your blood pressure. So, what is the craze behind it? So it's pink purely because they add a little bit of dye, a little bit of extra this and that. But at the end of the day, the sodium, the actual salt in there is exactly. So, let's speak about diabetes. And people often have this sort of misunderstanding that diabetes is a sugar problem. We know it as Satan. But in actuality, it's because of a problem with insulin. Now, the best way to understand it is that your body is a high performance vehicle. Right? The fuel is sugar. Now, in order for your muscles, your liver, heart, all these things to use that energy, it needs a key. And this key comes in the form of insulin. Right? Now, you develop conditions such as insulin resistance, type 2 diabetes, because of an issue with the key. Now, either the pancreas is not making enough keys for insulin, or the locks on the organs where the insulin works is rusted, which is what we call insulin resistance. Now, what happens is that sugar cannot enter the cells. So it circulates. It circulates long term. It damages the organs of those blood vessels. The common organs being your eyes, kidneys, your heart, your brain. Right. And so the main misconception is the insulin. Right. So the first myth I actually want to get into is, again, something I'm sure many of you are very familiar with. And I always smile when I actually hear this one because I find it very difficult to understand. So patients will often come in and tell me, doctor, well, I'll ask them, do you have any medical conditions? And they'll look at me and they'll say, doctor, maybe let a bit cider. A touch of sugar. Now, to this day, I don't know what a touch of sugar means. To me, it's like saying I have a touch of pregnancy, you know. It's either yes or no. Do you have diabetes or not? I don't know if it's a problem with committing to it or what. Now, again, our body doesn't care whether we call it a picky cycle or pre-diabetes, the damage is still occurred, right? And in actuality, the damage happens before you actually develop diabetes. And it's because of things like insulin resistance, when I'm speaking about the keys. But there is also hope. Diabetes can actually go into remission. It cannot be cured, but one can actually go to a place where they don't require any medication. It does, however, require a lot of lifestyle changes, diet, etc. So, my dad passed around these little questionnaire things. And this is one of the questions that actually came up. And I hear it all the time. And the myth is that metformin causes kidney damage or causes harm in whatever way, shape, or form. Now, for those of you who don't know, metformin is a drug for diabetes, right? Now, I often find that this myth comes from a place of misunderstanding. It probably came from a scenario where the doctor was trying to explain, look, your kidneys are now struggling with long-term damage due to the diabetes. Because this metformin actually needs to be filtered by the kidneys, we need to stop it. But sometimes they don't use the correct terminology and you get lost in clinical words. And it comes across as metformin causes kidney damage. But the actual truth behind it all is that it's the opposite way around. Metformin is and has been the first thing we go to for type 2 diabetes since the 70s, 60s, earlier than that. And it still is today used. And in actuality, if we look at it, it's the metformin that is saving the kidneys. We take two people, one diabetic not on metformin, one diabetic with metformin. The diabetic on metformin is likely to have better kidney function 20 to 30 years later versus the one that doesn't. So, if we really want to talk about the kidney killers, right, we actually could look at your own medicine cabinet. You know, those over-the-counter tablets that you get from the pharmacy, you know. And probably one of the biggest and not well-known sort of killers of the kidney is med lemon. So something we use very, very often for coughs, cold, flus, etc. But little do we know that med lemon contains the equivalent of 2 sachets of grandma. It's a very, very high dose of this one aspirin. Most of us take aspirin, you know, Ecotrin, etc., the orange tablet. Just to compare the two, that tablet contains 81 milligrams. Metformin, med lemon contains 800 milligrams. It's taking 10 Ecotrins. We take it 3 times a day for our colds and flus. Another one is grandma. Again, very high dose of aspirin. So, in this day and age, I know many of us, you know, we get the odd headache, or the back pain, or this or that, turn to pain. Grandma and discipline should be the last thing. In this day and age, the only time we use those medications is on blood thinners. People who've had heart attacks or strokes, and we now need to thin the blood.
It's a car, a Toyota Cross in front, CA 2729. The silver one. Yeah, the latest one got.
So, let's get on to the next one. So, this again, a very, very common one, and you often get very, very varying opinions depending on which doctor, which nurse you ask. And that is the myth of, I'm a diabetic, so I can't have fruit. And, I mean, I suppose there is some kind of a logic to it. Fruit is sweet, there's some sugar in it. But in order for us to understand what the difference between a fruit is and, you know, any other kind of sugar, is to understand that if you take a fruit and you take the equivalent in fruit juice, right? The best way that I try to explain it is to say that the fruit juice is basically naked fruit. It's carb. And what I mean by that is, when you eat an actual fruit, right, besides the juice, there's that nice pulp and all the little tissue segment type things. That contains all the rich fiber. So when you squeeze it, you're getting rid of all of that and just milking it of all the sweet juice. Right? Now, at the end of the day, whether it's a glass of juice, right, or an actual fruit, the juice is still in the fruit, right? So the sugar is still there. So what really is the difference? So that clothing, the fiber that I speak of, right, it actually affects the way that your body actually absorbs that sugar. So let's say, for example, an orange has 10 grams of sugar in it, right? I drink a glass of sugar, a glass of orange juice, right? Immediately, 10 grams of sugar goes into my bloodstream and the sugar shoots up.